My name's Kelly. I'm one of the unit-based educators for the third floor, 3 Northwest, 3 East, and 3 North. And we're going to be talking about wounds and the importance of measuring skin assessments and wounds as new patients are admitted to the hospital. I have Ann Loring, who is our education manager. I have Sarah Beeler, who is over the PCT program, and I have Rex Genovia, who is the 4th floor unit-based educator. So please, each one of you, please grab an answer sheet, and I want you to measure one of the 4 bottoms.
Okay. I'll start right here with this one.
Sarah and Rex, you can go ahead and just pick a bottom and measure it.
And I'm going to go lengthwise on mine.
Okay.
And we're going to say it's 3.5 and then get the widest part.
Yep. Widest part.
By 3. And then I'm going to check and make sure that I don't have any depth to it or any undermining.
Okay.
And it feels very shallow all the way around.
Good job.
I don't see any drainage on mine, but I do see an open skin area.
Yes.
And I think I'm done.
Okay, we're going to review these together.
Okay.
So I'll just let you leave that right here. Awesome job. And then Sarah looks like she's almost finished.
Yes,
Two.
I think I am finished.
Yep.
Okay, yeah, just leave it here.
Okay.
So the important part is when you get a new admission, we have to look at their skin, because if any of these people had come into the hospital and we had missed examining them, and especially any of these, but especially this one, if we had not noticed that and had not documented it on admission, we would have owned this pressure injury. So it's important to examine their skin on admission and then examine their skin every 12 hours and document. So as we go through, Anne very carefully, she looked at this and she said it was 3.5 by 3 centimeters and no depth, and she's correct. And if she wanted to go even further, she could say that's a stage 2. So she did excellent, excellent. She used all the tools that were available. And then Sarah measured this one. She said it was a 7 by 7, and it does have some depth, and that's correct. And that would be considered a stage 4. So we want to make sure, this one probably we need to consult the wound care nurse, especially if this is a new admission. We want the wound care nurse involved. If they've been here for a while, we need to consult the wound care nurse and definitely need to write up an IRIS report, because what happened, where was the breakdown? And then no one measured this one. I guess this was probably mine. This one is a 3.5 centimeter by 2.5 centimeter and no depth. This is a stage 1. And then this one, Rex measured it as 5 centimeters by 4 centimeters, and it does have a little bit of depth. This is a stage 3. So that's very important to make sure you measure and document as soon as they get admitted to the hospital, and then again every 12 hours. If they don't have anything, that's great, but we want to keep their skin as healthy as possible. And then we have dressings. We use the Alleven Life. This is for the heel, and you can you'll get step-by-step instructions when you get to the floor. But this pulls off, and that goes under the heel, and that goes around. And then these are for the sacrum, and you can see where this goes toward the coccyx. And there's the large and the small. We have several different sizes. This is the gentle border. This is the gentle border light. These are all gentle borders. They're just different sizes. And we use these on just about any kind of wound, especially if we're waiting for the wound care nurse to come. Any other questions?
One thing of importance to note also is that these dressings are intended for protection not for treatment.
Yes.
And so we use these whenever there's a risk for pressure injury or shearing effect
Yes.
to prevent further damage or any kind of a start of the damage. Once there's a wound identified, that really should be measured, carefully described in the progress notes, and then also the physician and or wound nurse should be informed about that, and they will recommend the best treatment. If this were to be identified, let's say in the middle of the night on a new admission, the nurse would absolutely need to apply a clean dressing on a wound.
Yes.
Clean the wound, describe it, apply a clean sterile dressing on the wound so that the physician the next day has a clean, healthy wound bed to look at and reassess for further treatment.
That's it.
Thank you. So this would be the PICO, portable wound vac. This is usually applied by the wound nurse or physician or APN when it's initially applied, and it's usually as the result of a deep wound that requires prolonged negative pressure to keep the fluids from building up and infection from starting. So it has the on-off button. When you turn it on, the lights will flash, showing an OK, and you'll hear it start to apply negative pressure to the wound bed. So the little disc should be over the wound, and then it should have a seal up away from the wound. So these go home with the patient.
And it has a little belt clip.
And a belt clip to wear.
So these do not have a canister, a suction canister present, is that correct?
That's correct.
And it should stay for 5 to 7 days, and it's disposable. It's a disposable wound vac.
That's correct. So after 7 days, the patient should be seen by home health nurse or primary care physician, and the wound vac should be changed with a fresh dressing, or and this one would be thrown away. It's disposable, or removed entirely to a different dressing.
Questions? No questions.